Just imagine there was some catchy jingle introing in. So, hey, I am Dr. Sarah Baxley, and I'd like to welcome you to the very first episode of What the Health, the podcast where we talk about health, life, and all the stuff you wish somebody would explain without using giant words like pathophysiology, differential diagnosis, and mesothelioma, which just happens to be my favorite word ever. Try saying it, it's kind of fun. So, like I said, I'm Dr. Sarah Baxley. I'm a mental health and primary care provider, a self-proclaimed healthcare nerd, and I am your guide through the sometimes confusing, often frustrating, but always important world of health. This is our very first episode, guys. So if you're here, you're basically a founding member on this journey, and I promise it's going to be worth you sticking around. Well, kind of a big promise. I hope it's worth you sticking around. So let's get into it. This episode is all about who we are, why we're here, and what you can expect from this podcast. Spoiler alert, it's going to involve some real talk. We're going to get down into the nitty gritty of some of the things that you are either too embarrassed, ashamed, or scared to talk to your doctor about. I'm going to give you a lot of information that you can actually use. So let's start with the big question. Why am I doing this podcast? Well, let me set the scene. So imagine that you've left work early. You've been sitting in the waiting room at your doctor's office 2 hours past your appointment time and just got told that there's going to be only 10 more minutes before you're seen. So while you're out there, you've Googled your symptoms, convinced yourself that it's either dehydration or something off of Grey's Anatomy without all the awesome sex scenes in the on-call rooms. And you're actually about to give up on getting any real answers because where the hell is your doctor? Does that sound familiar? Yeah, I thought so. It's basically everyone's experience when they go to a doctor's appointment these days. And this podcast is all about cutting through that bullshit, answering your questions, and making healthcare feel, well, human again. At Access Now Primary Care, which is my telemedicine practice that I started in 2022, I've seen it all, y'all. I have seen patients overwhelmed by too much information, coming in disheartened because they say their doctors don't listen to them, and folks just trying to figure out what the hell their insurance actually covers. So this podcast is here to make sense of it all, one episode at a time. All right, let me break it down for you. Here's what you can expect from What the Health. First, we're going to talk about mental health because let's be real, life is a lot sometimes. And mental health deserves just as much attention as physical health. If you don't think that your physical health is connected to your mental health, you are lying to yourself, and vice versa, guys. We'll dive into things like managing anxiety, dealing with stress when your in-laws come to visit, and understanding ADHD without turning it into some sort of alphabet soup situation. And next up, we'll deal with chronic conditions. I'm looking at you, diabetes and high blood pressure, and all the other shit that comes along with adulting. Have you ever thrown your back out from sneezing? Because I have. And I understand what you're going through. We're going to talk about how to manage these conditions without losing your shit or spending your entire paycheck trying to get answers. And of course, telemedicine, which is what I do. What even is it? How does it work? Is it just FaceTiming with your doctor in your pajamas? Yeah, sometimes it is, guys. I like to call that laced up from the waist up. It's where I am professional from the waist up, but have on pajama bottoms and slippers from the waist down. I don't mind if you take that and use it. We'll dive into why telemedicine is changing the healthcare game and why you should jump on this trend now. Oh, and don't worry, we're also going to tackle the important stuff like understanding your insurance. What do all those fucking words mean? We'll talk about the billing process and figuring out what your insurance rep means when they say, we'll call you back in 7 to 10 days. Now, I know what you might be thinking. Great! Another podcast about health, because there's not enough information on WebMD or Google, right? But that's just the thing. The internet is full of health information, and that is exactly the problem. It's too overwhelming. One click and suddenly your runny nose turns into some rare tropical fatal disease. Here's the deal, guys. I'm here to keep it real. I promise you, no scare tactics, no medical jargon that make you feel like a total dummy, and no shaming. This is a judgment-free zone. Just real talk, practical advice, and hopefully I make you laugh a little along the way. Because let's face it, if we can't laugh at ourselves, then what are we even doing here? So why should you keep tuning in? There's plenty of other podcasts, lots of other information out there that you could use. And you probably should. There's a lot of great information, a lot of people smarter than me. But this podcast is about you. It's about helping you feel more confident in managing your health, answering the questions that you've always wanted to ask, but have been too embarrassed, too ashamed, or too scared to ask your doctor, and learning how to advocate for yourself when you disagree with what your doctor's recommendation for treatment is. And hey, if you're one of those people who's ever walked out of the doctor's office and called somebody and been like, I don't know what the fuck my doctor just said, gotten a prescription and you didn't know what it was for, or a diagnosis that wasn't explained to you, you're in the right place. I'm going to help you understand all of those things. So, all right, that about sums it up. That's enough about me and this podcast for now. Next time, we'll dive into mental health with an episode on managing anxiety, what works, what doesn't, and why deep breathing can only get you so far. In the meantime, make sure to subscribe so you don't miss an episode. If you've got questions or topics that you want me to cover, shoot me a message. Find me on social media. I'm on all the majors, Insta, Facebook, TikTok. You can actually see some of my rapping videos because I'm pretty fucking great at it on TikTok. Dr. Sarah Baxley, DrSarahBaxley. So let's make this a space where we answer the questions you want to know and give you information that you can actually use. So thanks for hanging out with me today, guys. I'm Dr. Sarah Baxley, and this has been the very first episode of What the Health? Take care, stay curious, and I'll see you next time.